Hi everyone, welcome to Good Mental Health. This side psychologist Anuradha. So today I've come up on a very special day that's important. I could not miss this day to be, wherein I can really share certain things which are important, and I can let you know the importance of this day. Today is World Mental Health Day, which is being, celebrated as to aware more and more people about taking care of your mental health. Mental health is equally important as physical health. We cannot miss this. And WHO has also mentioned that there is no health without mental health. So just like the way you take care of your physical health, when there are certain things happening to you in your life, maybe when you're physically not so well, so that's when you seek help. You go to a doctor, you tell them about your concern, and that's when you can get rid of your health issues. And mental health is equally similar to that. So you only need to focus on that, never ignore it. That's the important thing. So when you will take care of your mental health, what is going to happen? That might be the question of many people. See, when we ignore it, there are more and more troubles we are inviting in life. There are more and more, problems that we are creating. When we are ignoring that important part of our health, that's what is, that's when we are inviting so many other things in life that can really accumulate in our, when we are just trying to suppress our emotions, that can accumulate in our body in some way and can show up in certain ways. There are people who mention there are certain pains they are experiencing in their bodies, which no other doctor is able to specify that what is the reason. Maybe they go through or undergo certain treatments. There are a lot of physical health things that is being taken care of the medical expert. But when such things are not being coming into the picture, that's always a concern due to mental health condition. So whether it is overthinking, stress, or whether it is some depressive feeling you have, maybe you are going through a certain phase of your life which was really tough for you to handle that situation, right? At that point of time, you need to understand that if you are able to handle it nicely, that's fine. But that particular thing is disturbing, disrupting your peace of mind, affecting your daily things, daily routine, then that is the thing that needs special attention of a therapist, right? So there are a lot more we are going to talk about today. So if you're ready to listen to me and you are happy to seek some help today, so stay tuned, and definitely maybe in the comment section you can write down that we are ready to hear. So there are 2 people joined. So hi. So all of you are live with me, so I'm very happy. Here I can see one of my friends, Shivani, is here. Hi Shivani, very happy to see you here. Okay, so in general, we are going to talk about a lot today. And firstly, I would like to tell you that, when we take care of our mental health, that's important for us to really understand. Hey, hi, I'm doing very well. Happy to see you, Shivani, after a long time. Stay in touch. So, all right, friends and audience, I'm very happy to have you here. Those who might join in some time, welcome everyone to this live episode, and there's a lot of understanding you can gain, and I'm excited about it. So happy Mental Health Day once again, and let's begin. So importantly, you need to take care. If there are certain things that can let us know that we are actually going through something in our life, and these signs are very simple to understand by our loved ones. It's not easy for everyone to see. Maybe externally you are really thanks Utkarsh. So maybe you are externally showing the world that you are absolutely fine. Not everyone can see your journey, not everyone can get to know that you are mentally disturbed, because there's a lot you've been really trying hard to show everyone that you're absolutely fine. You can fake your happiness, maybe you can smile a lot, all of these things you're doing under pressure. And now when you are aware of it, you need to really work upon it, and your loved ones can easily see these signs. How they can see is that they can see that you're not being yourself lately, and maybe there are a lot of depressing feelings you're showing by in your talks, maybe in daily routine, the statements that you're using. Maybe you're not getting up from bed easily, you're taking a lot of time to do the usual tasks that you used to do earlier, and lot of things your loved ones can see. And also when you're not finding interest in certain things which you used to enjoy, you're not eating healthy, you're not sleeping well, there's lot of trouble that you've been facing in every little thing that was actually okay for you earlier, but now it's really getting very difficult to do. So these are the signs that tell everyone that there is something going wrong. If this has been happening maybe for a day or two, that is okay. But if this is been stretching from a day to, it is really stretching to a week's time, and from week's time to a month's time, then this definitely is not fine. That is where, or that is when you require a therapist attention or some help, right? So before that, what steps you can take so that you can ease yourself, and maybe that can help you. So at home, maybe you can share it with somebody whom you trust, whom you feel safe with, and you can definitely tell them about what you are experiencing, feeling, what are your emotions, what is something that you're not happy about, right? After sharing all of these things, if you find the ease and you think that whatever you have vented out, it's absolutely okay, and that is not troubling you, bothering you, not disturbing your life, or not impacting your daily routine, then it is absolutely fine. But you might have taken chances and shared it out to not one or two or many people, right? And after that also things are troubling you, bothering you, and you've not been able to come out of that situation. That's when it becomes serious. That's when you need a psychologist, you need a therapist, you need some help, right? And yes, Utkarsh, that is absolutely right. It is important for us to observe, but when somebody is experiencing the emotional health concerns, sometimes they are not able to see fully that what they are experiencing. Initially these symptoms are not easily understood, but later when it is a long time period, definitely then a person can understand. Okay. And so this is how a person can get to know that there is some trouble and they need some help. Okay. Also, moving on to, now that signs and symptoms you have got to know, importantly, when you seek therapy or when you seek help from any specialist or a therapist, what you need to take care of, and what are the steps and exact process that will help you to in advance know that what exactly happens. And because there are a lot of people in the world who doesn't know what exactly happened in a therapist room. They don't know in a therapy session what exactly is going to happen, what the therapist is going to do. Everyone has their own notions, everyone has their own understanding, and everyone thinks it differently, that what actually happens in a therapist room. So I want to really help you understand that what exactly happens, and then I will jump on to the sharing the process, right? Basically, many people have this notion that therapists are going to talk about the childhood, maybe the friends, maybe the people around, maybe the family members we live with, and lot of general discussions wherein they will seek some information, wherein they are going to talk about certain areas of our life. This is what is going to happen. Many people think this way. And now people have this notion that it is going to be a talk session only, and which is why many people think that what is the need going to a therapist, why should we go, what is wrong with us, and maybe we can share it out with our friends and family, we are our own therapist, right? At that point of time, that becomes really difficult for them, for their future. When you share it out with your family and friends and things are still not getting better into your life, and things and when you are still struggling, right, that's what tells you or maybe prepares you to understand that you need to have the acceptance. When you're sharing it out with your family, friends, and maybe with your loved ones, that way it's not resolving the issues and it is not helping you out. So the best way and the best strategy is always that seek help from a therapist, because therapists are trained people. Therapists are someone who will help you, empower you with your capacities, capabilities, will help you increase or maintain your mental well-being. They will empower you with a lot of strength, and that you can gather within yourself. It's important for you to have a self-understanding about you, that what you can accept in life, what you can't, what is right for you, what is not, and what are the strengths you have, what is your weakness. And there are a lot of areas that therapists dig into during the therapy session, and that too in a therapeutic manner. Definitely the conversation does happen, because otherwise, of course, the therapist is not going to get to know you, that what you're going through, right? Definitely a therapist is going to ask you a lot of questions. Questions are going to help therapists understand you, your psychology, your struggle, what has been happening into your life, what is the pattern, what is the root cause. By asking lots of questions, therapists will reach to a root cause, and that's when the whole scenario changes. So the therapist finds out the root cause by reaching out to different areas of your life where there might have been struggle in your life, where there might have been a lot of negative patterns in your life. There might have been some traumatic incidents, episodes that has happened in your life, and lot more. All of these things are creating trouble into your life, right? So when therapist is slowly and gradually taking you to all different areas of your life, is going to be a little exhausting for certain people. But sometimes when therapists are asking those questions and reaching through those memories by therapy, at that point of time they are wiping away all of your pent up emotions, the old memories which you no longer required, right? So it's important for you to have an understanding that in the therapy room, the therapist is going to talk to the client or the patient in a very therapeutic manner, where they are using therapeutic techniques along with talking. And those techniques are helping the patients to get rid of their emotional health concerns, get rid of their depression, anxiety, stress, worry, or any XYZ the concern or condition they have. So it's never a quick fix, it's never a one night thing that overnight things will change into your life. Every conversation, every therapeutic session is very special, and session by session you can see the changes in you. Session by session you can see the great change and the calmness in you. And this is when you can experience that you are getting rid of certain emotions and getting rid of the certain issues that you've been facing, and you will become a one wholesome person, where you will no longer feel difficulty in handling emotions, handling or coping up with so many situations that come in our life, right? So when you will become mentally strong, imagine you won't be able to struggle with any difficult emotions, right? So it's important for us to be mentally so strong that if any challenges are coming into our life, maybe when things are really going difficult, and anything that has been happening that is not so easy to handle. There can be adversities in life, there can be some emotional difficulties, the situations which might be very tough for us to handle. So this could be possible to be the part of our life, but we should be emotionally that strong so that we can face it, we can overcome that trouble, we can overcome with our emotional situation, we can overcome with that adversity as well, and we are ready to face the new life, right? So this is what is the role of therapeutic session and therapist. And therapist will help you to empower so that you can be ready for your future. So what has happened, until now will be resolved, and for future you become better and emotionally stable and a strong person, right? And definitely the troubles does not come or end in our life. There's always a new day. There are a lot of things that we do face in life, but once we know how to deal with things, so everything is going to be sorted out in life. So when you will become a powerful person, when you are mentally strong, when you develop healthy habits, you know and learn the techniques that how you can take care of mental health, then definitely you are going to live a happiest life, the best life. And this is all everyone needs. I really think so, right? Yeah. So okay, moving on to the another part, and which is the process. And many people does not know the right process, how to start or get into the therapeutic session, or go, when those who are very new to a psychologist, a therapist, a psychiatrist, so they need to understand there are certain things that need to be followed. I am explaining here that what a psychologist practice for and what they focus on. So whenever there is any client who has come to us, it's important for us to have, firstly, there's a foundational approach that everyone needs to understand, and there are basic steps in that, and that everyone is supposed to understand. Number one thing is to have a consultation. So there are many patients who do come and directly they just want a therapy session to begin, right? I understand that maybe they don't have the understanding about that what is to be done, right? And the right way to get into therapy. It's important for everyone to understand that any therapist, or let's say if you go to a general physician, there is a certain issue that is why you're going to a expert. If you will go to an expert, it's not that they are going to directly ask you to lie down, that there is a surgery planned and you can't do this or that or anything. It is important for your doctor to understand you, right? Only after understanding you, then the doctor can suggest a specific treatment for you. So it is exactly the similar thing with us, right? A psychologist need to first have a understanding of you, have a history about you, note down certain important points that what you're going through, wherein the psychologist can ask you a lot of questions, maybe relating to what brings you here, and after when you start describing about what is the certain issue you are experiencing, those issues when you will talk about, there are a lot of millions of questions that a therapist are going to connect and maybe take you to the different areas of your life and deeply have the details of every single thing. Okay, so in consultation there are many things that are being noted down by the expert, and once we have the record of what you are going through, what you are experiencing, what might be the root cause, we try to figure it out, and then the next stage comes wherein the counseling session happens. Along with that, an assessment time is there. So psychological assessment is conducted. So now the history has been taken, the counseling session has been done, where the rapport building has happened between the client and the therapist, right? The patient has developed a kind of understanding with the therapist, and which is what allowed them to really express themselves fully in a very non-judgmental environment, in a very good way, so that they can feel happier, acknowledged, heard, and simply feel themselves as who they are, right? And when this thing happens, the next step is psychological assessment. So psychological assessment is taken. It is important because whatever we have understood out of what the patient has explained or expressed, It's important for us to know that the emotional health concern, the symptoms they have shared, we need to know the intensity of it, whether it is mild in nature, moderate in nature, severe in nature, or clinical, there is an extreme clinical level, right? So that's what, when we will get to know, we will be able to reach out to making a diagnosis about it. And once we reach to that stage, that is what will allow a therapist, that is what will allow a psychologist to help have a treatment plan to the patient. So once we have made the diagnosis, it is easier for us to know that the patient is dealing with so and so issue, and now the next step is starting the treatment. So we make the treatment plan that this is how the things will happen according to the need of the client. We make the particular kind of selection of the therapeutic approaches that we are going to use in the therapy, and that's what we share with the client so that we can make them feel easier, comfortable, and aware about what we are going to use, right? And once we share that, there are a lot of chances that people also wanted to know about the monetary aspect, which is, I am sure, the very important for everyone, right? So once you know your treatment plan, you have all the rights to know and ask the therapist that what is going to be the cost of it. And knowing the cost and everything, the detailed understanding about the treatment plan, you can step ahead further. So this is the entire process where it starts with the consultation session, then moving on to a counseling where you build the rapport building with the therapist. And when you have the ease, you have that rapport building happened, and you're easy to share everything with your therapist. And then the psychological assessment happens, and which actually clarifies or make help the therapist to make the diagnosis. And once the diagnosis is done, so treatment plan is being shared. So these are the steps, and along with that, once the treatment has started, the therapeutic sessions are happening. So that helps the individual to each and every time during the session to explore different things, to understand and have this self-awareness about themselves, and to have the understanding about their surroundings. And lot of coping techniques and strategies that are being shared by the therapist is also very important part, and which a client or the patient is supposed to use on a daily basis. So generally, if I talk about me, so every time starting from the first therapy, I keep on giving lot of self-help techniques and the particular practices that is very much designed in a way to help a certain kind of a problem, certain mental health condition a person is facing. It's important for you to have the right idea of things about what you are experiencing. You can ask several questions from your therapist so that you also know that what you have to begin from, what practice, how you have to do it, and you have to do it rightly. That is important. So those techniques you have to utilize at home along with the therapeutic sessions that have been happening. And now many of the clients do ask that what is the duration of each therapeutic session. So generally it is 45 minutes to 50, and in my clinic I do it for 1 hour, and sometimes it goes up by 10 to 15 minutes more, right? So this is how I do my practice here, because when we are totally into helping the patient, it's important to resolve everything, but importantly every client has to understand that there is a limit for you to be putting a pressure or load onto your brain. When we are doing the therapeutic sessions, it's important that there is a limited time period. 1 hour is enough for you to deal with your brain, go through all those difficult memories which you may not want to share or may not want to talk about in your life. But that is the space when is given to you. If a therapist is asking you and reaching out to those areas, it is meaningful. It is important to go through those areas of your life. Maybe those difficult memories you can share, so that once and for all you get rid of those emotions, rid of those thoughts and the patterns that they have created. And maybe there's a chain of thoughts that has been, you know, happening from your childhood, or maybe any part of your life. That can be childhood, that can be teenage, and maybe adulthood, and maybe certain areas of your life. So sometimes there's a chain formed, and that's been, when recently something has happened because of earlier time, there has happened somewhat kind of a similar event, or emotions, basically you have gone through the same emotions that triggers you very badly. So this is how the therapists work, and they reach out to every segment, and it's important to talk about it, and only you can just share it when you feel comfortable. So sometimes few things are not does not happen on a first session itself, but because there's mostly the first session is focused on a very immediate need of a client. Why? Because when a client has come to us, it's always at that point of time the emotional concern they are dealing with, it's very heavy for them to handle. The lot of things that is being triggering, and maybe the thought of the patterns and the chain has been built from today to that day. We can reach step by step, but immediately on the first session, it's important to focus on the present, and eventually the therapist move on to the very earliest stage, when actually the event has started to take place in the subconscious mind, right? So maybe first session is quite difficult, that might take a little lengthy time than usual, and then when you will reach to the second session, so there might be a lot of ease, because obviously the rapport building has already happened, and the ease has developed, the person has already felt the difference. And when you feel lighter, when you feel that things are better in your life with the first session, because talking or the conversation is the first step towards healing. That's what I believe, because when we talk about it to a therapist, and that too in a very therapeutic manner, the therapist is taking care about it, so of course a lot of things are going to resolve at that time. Thank you, Malini, thank you so much. Okay, and moving further, so in the second session things are going to be more coming into the picture, and therapist can help a lot. And moving on with number of sessions, definitely the emotional health concern is being taken care of, and slowly and steadily the person starts to feel balanced and better, and can come out of their emotional health concern. Also, they start to have more and more awareness about themselves, about their surroundings. Usually what happens in our life is that we are more engrossed in our daily routine. We are just kind of mechanical in nature, if I have to use the correct word. So what happens is that every day we are doing certain tasks in our life. From morning we get up, do those certain tasks that we need to do, we perform every daily activities, then we rush for our work, right? And then again, after coming back to home, there are a lot of other things that we focus on. So it's kind of a similar pattern each day, right? And that point of time, if there's something we are dealing with emotionally, we might are not being able to focus on it, and sometimes people just do not prioritize their mental health and think that we can just take this or consider it later, because there are a lot of other important things maybe are in our queue. And I want to here specifically mention that when we have cold or cough, right? In our daily routine, we are so busy doing a lot of things. But when there is a physical health concern, so we stop by and we look for that we need to work upon it, because that is a concern which is actually showing up again and again. If we have started with a cough, that's what is bothering us. We need to have some help for that, and we think that going to a physician can help us. Maybe some medicine can help rectify this thing. And if we have fever, of course we are so low, we cannot really go to our work or perform our daily tasks, because our energy level is completely zero, right? And that's when we actually eventually realize. And here I want to put kind of importance that when we are struggling with emotional health concern, mainly and mostly what happens is people think that it is not important, maybe we can deal it separately, and maybe we can sit in some silence, have a good time with ourselves, spend some me time, maybe by doing certain things we can just get over it. So my dear friends, everyone who is watching me right now or who will see this live later, importantly, you have to understand, never brush your emotional health concerns under the carpet, because it's important to look right there. Because if we are ignoring it and we are piling up things one after another, maybe we are ignoring it and we are able to manage our emotions for this particular point of time. What happens is, later, within some time, maybe that time we have managed, we have handled everything, maybe down the line 2-3 months or maybe 1 year later, there happens something in our life, and again there come a situation where we are not being able to handle our emotions. Again you tried your best, again you did several strategies, you used self-help tips, maybe you tried out every best thing, sharing it out with your loved ones, with your family, with your friends, and maybe anyone you feel comfortable with. And that time also you felt that yes, I'm bold enough, I can take care of it. You ignored and you continued your life just like that, right? So now, after just ignoring it several times, what happened is that emotional health concern starts to accumulate in our body, show up in some another form in a physical health concern. So everyone has to be very aware, very vigilant, very watchful. When you are dealing with the emotional health concern, it's important to pay attention. It's important to understand the nature of it. It's important to know that what you're dealing with, there's a limit for you to be tolerating, and maybe you trying to suppressing your emotions. It's important for you to really understand what you're going through. Give yourself some pause. First of all, just accept what you're dealing with, accept your emotions, and have an understanding that why is it happening with me, what is wrong, and maybe try to figure it out, that what you can do to help resolve your own condition, own emotions, right? So once you know that what is the next step you need to take, definitely that is going to help you, and that will give you a way out. But never ignore. It's important for us to focus on what we are dealing with. If it is straining us, if it is taking more than a week's time, jumping on to months time, and it is still stretching, and now it has started to impact your daily life, it is the time that you need help, and never ignore that, and just understand that it is equal to our physical health. If we are going to ignore our mental health, that is going to shape in some different way and show up in our body in some another way, right? Because it is directly linked with our physical health. So always prioritize your mental health, take care of it. So I hope everyone has understood the process. I discussed about a lot of things today, the signs and symptoms also, and what you should be doing once you are dealing with any emotional health concern. It's important that first we need to acknowledge, accept it, and try to work on it, and find out the ways by yourself, that what all you can do to deal with it. Once you know that what you have to do and what you should do, it's really, really great. And when things are hampering in your daily routine, that's when you need some help. So I hope I am clear with all of you. So all of those who are watching me can just say hi, and maybe if you like this information, really informative, so that is always great. Thank you so much. So I'll just stay here for if anyone has certain questions, so I can help you out to give you some solutions on it. So people who are here are, hi Raj, hi Sumit, hey, hi Mr. Brendan. So everyone, thank you for joining. So if you have any specific question, if you're dealing with any emotional health concern where you feel that you need a direction, you can ask me right here. So just a few more minutes I'm live, and then I will just turn it off. And there's always, you know, a situation where people, when they come, they ask me about maybe just give me a quick self-help tip or a quick fix that I can just, you know, get rid of my concern, whatever is happening to me. A lot of times people do ask me this thing. So I want to tell you that there is not any quick fix for any situation you are dealing with. It's a process, and it's a gradual process. It is a step-by-step process that might will take a little time, but it will help you resolve your emotional health concern deeply. Right? So you need to focus on following certain things. Definitely a lot of self-help tips, lot of techniques, lot of exercises can be provided to you to help ease yourself just for that particular moment, right? It happens that, you know, when we are dealing with something at that point of time, we want to just get rid of it, right? If a person is dealing with anxiety, it's a very uncomfortable thing to really face, right? I understand that. At that point of time, there are a lot of self-help tips that you can utilize to ease your anxiety at that point of time, so that you can immediately come out of it. So one of such strategy which I can share with you right away is, any point of time you start to feel anxious, you can just immediately take a ice cube and put it in your mouth and keep it there, and just you know, visualize and put all of your senses you know, towards that piece of ice inside your mouth. You need to see that how cold it is, what you're feeling, what is it you know, sensation it is giving to your tongue, and everything. Your focus totally on that ice cube. When you will put that ice cube in your mouth, that's going to ease you down. That is going to help resolve your anxiety for that particular moment. But definitely that's not a permanent solution. Also, that's not the thing that will help remove your anxiety forever. It is a self-help tip for that particular moment when you are into it and you don't know how to come out of it. That is one of the technique, right? And another technique while you are experiencing anxiety is start doing deep breathing exercise. That is going to help you calm down completely, fully. It's important for us at that point of time when we are dealing with anxiety, so that we should not reach to another level of panic attack. It's important to start doing deep breathing. Deep breathing exercise will help you stay grounded, right? It's important for us at that moment to feel normal, to get back to normalcy, feel balanced, and have that attention back and focus back in the present. So at that point of time, you can just inhale as deeply as possible and exhale even for a longer time. So inhale through your nose and exhale through your mouth. It is the important technique that you need to follow, and remember that. Okay. And if you have more questions, that if you want some self-help tips, definitely you can go on to my YouTube channel, Good Mental Health by Psychologist Anuradha. There you are going to get huge information about how to deal with your depression, anxiety, excessive worry, overthinking, and many XYZ emotional health concerns. So those practices you can just follow in your daily routine. Also, if you have sleep disturbances, so issues with any other condition, you can just go and subscribe to my channel, get that information. Whatever is of your use, definitely follow those things in your life. It is going to help make your life healthier emotionally, right? So if we are emotionally healthy, definitely we are physically healthy. And I'm never saying that only take care of your emotional health, but emotional health is equally important as your physical health. So take care of both your overall well-being in a very best way, so that we can live a happy and balanced life, and we can live, you know, very cheerfully. That's what happiness is the next word to mental well-being, right? So if you're happy, you're mentally good, mentally sound. And a mentally sound person is the person who has no emotional health concern, who is ready to, or who is capable of handling their daily life situations, be it some challenges, be it some adversities of life, be it anything in life. When one is able to face or deal with certain situations, then they are mentally sound. So we should aim for having a mentally sound life. We should aim for living happily and blissfully. So I will always recommend everyone to take care of their mental health, because there's no health without mental well-being. So prioritize it. Always keep this into your mind, that has to be taken care every single minute, every single fraction of seconds, right? So it's almost, we are at the end of the show now. I would like to tell you that just stay connected with me. You can go to my you can connect with me through my Facebook page, through my Instagram, through YouTube, through LinkedIn, through Twitter. Everywhere you can find me. We are available at Insta, Facebook, Twitter, LinkedIn and YouTube. So go and subscribe to that channel. Also just be in touch with me through all of these social media platforms, wherever you feel convenient with. And staying in touch will help you have more and more self-help tips. You can have the collection of things with you whenever you're dealing with any situation. You can utilize one of those things and you can become a mentally sound person. So thank you all for watching. It was a very good time for me sharing out my expertise and helping you out resolving certain things. I hope this was been informative for everyone. So God bless you all. Stay very blissful in life. See you at my next live and see you soon. And stay in touch for following those self-help tips. Definitely you can follow me. That can help you have the latest update, whatever I am posting on the social media. So thank you. Take care. Now it's my time to say bye-bye. Rab Rakha. Take care.